Nebraska Office of the Inspector General for Child Welfare oversees state programs for children, providing investigative oversight to ensure transparency. Their annual report is nearly 70 pages of analysis into how the Department of Health and Human Services is serving Nebraska's children. Our Darsha Dodge dug through that report and joins us now with more on what we need to know. Darsha?
Madison, this latest report covers last July through this June. Among the findings, a 110% increase in the amount of hours Nebraska's youth are being kept in solitary confinement, and a slight increase in child deaths. But the lengthy report covers more than just child deaths. Consistently high number of youth are being committed to Nebraska's 3 youth regional treatment centers, approaching the limit of each facility's capacity and leading to an increase of assaults on staff. Inspector General for Child Welfare Jennifer Carter saying they investigated 5 assaults on staff by youth at Lincoln's facility, with 4 in a 3-week period. Carter says it's a problem the legislature might have to address to make sure these YRTCs have the resources they need. Centerpoint Crisis Services Director Ashley Chisholm explaining the approach to youth mental health treatment is different, and the need for services is high.
That is definitely a need. Sometimes there's no place for these youth to go, and parents and families are just they need that break, and there's nowhere for them to go and no way for them to get respite from each other.
Centerpoint is starting square one, which will bring 4 more respite youth beds to Lincoln. The OIG's report also showing 3 children were committed by the courts this year to the Lincoln Regional Center, which is an adult facility.
What I think it really speaks to, though, is judges are sometimes in the position where there isn't a juvenile service or facility that can serve some of these youth who have more serious psychiatric needs.
Carter reiterated her office believes the LRC is doing what they can, but sending children there shows there is a gap in the continuum of care. Carter added there is no desire to institutionalize children unnecessarily, but they've asked the legislature previously to look at a youth facility in the state. We'll have to wait and see what, if any, of these issues the unicameral takes up in the next session, and we've got more on this report on our website.